Spinal stenosis occurs when the spaces within your spine become narrowed, placing pressure on the nerves in the spinal column. Spinal stenosis happens most often in the lower back and the neck, so these are the two areas where you're most likely to feel discomfort. Most people with spinal stenosis are over the age of 50. Spinal stenosis is typically caused by one or more of the following. Wear and tear. Changes in the spine are often related to osteoarthritis. This condition can trigger the formation of bone spurs which grow into the spinal canal. Herniated discs or slipped discs. Discs are rings of soft tissue between your vertebrae that act as shock absorbers. Herniation occurs when part of the disc becomes displaced, putting pressure on the sensitive spinal nerves and causing pain. Dryness. Discs sometimes dry out with age, increasing the risk of stenosis. Thickened ligaments. Ligaments help hold the bones of your spine together, but they can become stiff and thickened over time. These thickened ligaments may bulge into the spinal canal. Tumors. These are uncommon, but may form inside the spinal cord, within the membranes that cover the spinal cord, or in the space between the spinal cord and vertebrae. Spinal injuries. Car accidents and other physically traumatic events can cause dislocations, fractures, or swelling in the spinal column. Stenosis can also be caused by a congenital spinal deformity such as scoliosis, which is also known as curvature of the spine. Some people with spinal stenosis don't have symptoms at all. Others may experience varying degrees of pain, tingling, numbness, and muscle weakness. Symptoms can worsen over time and vary depending on the location of the stenosis and which nerves are affected.